Good morning, everyone, and thank you for joining us today to discuss some of the latest information that's coming out about COVID-19 and how it may or may not affect our pets and other animals in the environment, as well as our own public health and safety. I am Dr. Megan McAndrew. I am the Vice President of Medical Operations here at Humane Rescue Alliance. I'm happy to be here with everyone today. I'm also joined with my colleagues, Danny and Jenna.
Hi guys, I'm Jenna. I am the Director of Foster and Volunteer Resources and really happy to be here with you all.
Hey everyone, I'm Danny Rizzo. I'm the Digital Director here at the Humane Rescue Alliance. Excited to be here. I wanted to cover a few housekeeping items with you guys before we get started. We absolutely want to hear from you. If you have questions, feel free to use the chat functionality on the right-hand side of your screen. All questions are going to be moderated. They won't be immediately visible for everyone to see. Jenna and I will be moderating the chat function, so we are happy to respond to questions privately. If you have any technical issues, we can help you out. And we'll also be publishing questions that the full group can see as well. At the conclusion of the webcast, we will be posting the recording to humanerescuealliance.org, so you can go back and reference it at any time. We encourage you to share it and really appreciate you being here. Also, just a quick how-to on how to use the Q&A panel. On the right side of your screen, you'll see a little question chat box. You can click that to expand the live Q&A chat window, and you'll be able to see questions that have been submitted, and then you'll be able to post your own questions there as well. It looks a little something like this on the right-hand side. So without further ado, I'll give it back to Dr. McAndrew and we'll go ahead and get started.
So with the chaos of the times and data changing every day and more research coming in and news articles stating one thing that may not be clear and contradicting another, I just wanted to give the opportunity to kind of try to make things a little bit simpler as I've been trying to keep up on the latest research and wade through what is fact and fiction as well. Lots of times what we are hearing on the media is very alarming, and I think it is useful to have some guidance as to what some of these claims and statements mean. So I wanted to just kind of go through what we've seen and what we know at this point as far as COVID infection and exposure in animals. We first heard about a little dog in Hong Kong, 17 years old. She was quarantined because her person had tested positive. She tested negative before she came out of quarantine and then died in her home. This is a 17-year-old dog. She had renal and heart disease. The stress of the movement and everything, I suspect that that was more a contribution to her death than actual COVID infection, even though she tested positive as shedding the virus. And then we had a young shepherd in Hong Kong who also tested positive after his owner was tested COVID positive. There was another dog in the household who never tested positive, and this young dog never showed any sort of clinical signs consistent with COVID. It was just something that he appeared to be carrying, but no sort of illness resulted. There was a cat also in Hong Kong who tested positive after his owner tested positive. Again, that cat never showed any symptoms, cleared the infection, became negative. So we haven't seen much concern about our animals' health at this point. Then we saw a cat in Belgium who tested positive after his owner tested positive after visiting Italy. That cat did show respiratory symptoms and GI symptoms, but it's unclear as to whether there was something else going on with that kitty, whether it truly was a result of COVID infection that he was exhibiting these symptoms. There is a feline coronavirus that we've known about for years and years that causes GI upset. and is pretty ubiquitous in the feline community. As far as I was able to determine, other tests were not done to see if maybe the feline coronavirus, which is only slightly related to the human coronavirus that we're seeing, actually was tested for. It's my understanding that he was not seen by a vet and has not been seen by a vet yet. He should be coming off of his quarantine shortly, and there are publications suggesting that more information will be coming out shortly after his quarantine period, and potentially antibody testing to determine if he truly was infected. Again, even if he is positive for antibodies, which is the body's natural response to infectious agents, that does not mean that necessarily caused the symptoms he was experiencing. That cat did recover after a 9-day course of clinical disease. Then we had the cat study in China, where there was a very small number of cats who were intentionally experimentally exposed by the nose with a very, very high volume of the virus. This would be something that would not be environmentally possible. So the intention was to experimentally infect these cats. The cats did become infected, and then there is some evidence that another cat was infected, while 2 other cats were not, who were in the same housing area. This was a terminal study, and there was not pathogen found in the lungs. It was only found in tonsils and trachea, so the upper part of the airway, and none of those cats became clinically symptomatic for COVID. Also in that study, 2 of 5 dogs who were purposefully infected did test COVID positive, but again, no clinical signs were ever seen with those dogs when they were tested. All other livestock, poultry, many of the other animals they tested, none of them came up COVID positive when they were experimentally infected. We do see that more and more the research is supportive that ferrets are a carrier and can show symptoms of illness if exposed. Ferrets are the species that a lot of the testing is being done for vaccine development and treatments. So this study is suggestive that perhaps cats and ferrets, we do need to be a bit more conscientious about spread of disease. Again, this is from animal to animal or human to animal potentially, but not animal to human. That's very important. We still have not seen any research anywhere that would be suggestive that humans can acquire infection from animals. IDEXX has also been testing. Their main testing sites were the US and South Korea, and they're now extending to Canada and Europe. To this point, they've tested 5,000 animals, and none of those animals have been COVID positive. So that's encouraging information to have. And of course, the most recent concern is the tiger who tested positive at the Bronx Zoo. I was able to get on the phone with someone from the Bronx Zoo yesterday and obtain a little bit more information, because I feel like there's a lot of assumptions being put out in media without a lot of data behind it. You know, one of the things that's still interesting is we're seeing all these tests, and these tests from all over the world are not the same test necessarily. And the tiger test was confirmed by 2 different universities as well as an outside laboratory. When I spoke with the representative at the zoo, they did test for other feline common respiratory ailments and came up negative for anything else. So this is the first time we're really seeing definitively that it is likely COVID that caused the symptoms in these tigers. The symptoms that we're seeing are dry cough, which is fairly uncommon in cats. For those of you who have been around a lot of cats and had a lot of upper respiratory infections in cats, It's mainly nasal discharge and ocular discharge we see, sometimes some trouble breathing, stuff like that, but we very rarely hear a cough in cats. So that was something that was unique with these large cats, is that they had this dry cough, which kind of, made the vet team there a little bit more concerned. But again, they tested negative for everything else but the COVID-19, and the COVID-19 was confirmed by 3 different laboratories. The only exposure that is known is a potential keeper who worked with 4 tigers and 3 lions who were clinically symptomatic. Only one of the tigers was tested. They are collecting fecal samples to be able to do further testing to determine if COVID-19 is apparent in the feces of the other cats. That isn't currently what's happening, but they're collecting those samples to be able to pursue that route. All of the cats are doing well, and it was very mild clinical signs, this mild dry cough, a bit of an appetence in one of the 2 cats that resolved without any further palliative care or anything like that. They just kind of kept the line, and the cats are all doing well now, so that's good news. The thing with this too, though, is was it the zookeeper who exposed all of the cats individually? There's some suggestion that that is the case, given the lions and the tigers aren't housed together, and it is the 3 lions and the 4 tigers that we're discussing here. So there was at least some transmission without cat-to-cat contact, since those cats were never in contact. But it is possible that each of those cats was directly infected by the zookeeper. They're still looking into that. They don't even know yet who that zookeeper is, but they should be publishing more by the end of the week, is what the representative from the Bronx Zoo informed me. So the recommendations really haven't changed with all this new development. I mean, we have a handful of animals now who have tested COVID positive. One definitive that was showing clinical signs consistent with being infected, but we're seeing hundreds of thousands of people across the world being infected and showing clinical signs, and we're seeing very, very few animals who are showing any sort of signs at all, and there's no evidence that animals can pass it to humans. So I think it's really important to keep that in mind. Right now, all of the World Health Organizations and US organizations recommend that if you are infected, if you are exhibiting clinical signs of COVID-19, to protect your animals as well as your family. Wear the mask, wash your hands before and after handling your pets. Don't cuddle with them, don't share food with them, don't kiss them while you're exhibiting clinical signs of disease. That recommendation has not changed up to this point. As we know, things are changing daily. So if that recommendation does change, we will make sure to alert our HRA community and on next steps that should be taken if that does become the case. Again, there's no indication that that will be the case, but if that information changes, then we will be there to support our community. Guess we'll go to questions now. I know we got some questions in from you guys overnight. The first question, should infected animals avoid contact with pets? Again, just to reiterate, yes, you want to keep everyone in your environment safe, everyone in your family safe. This does include your pets, because we have seen that there is possible transmission from humans to animals. With very little showing clinical signs, but we don't want to test that, or, especially if your animal may have a weakened immune system, just keep them safe like you would the rest of your family. And it's really, really important to have a plan in place to have someone care for your animals if you do become ill. The last thing we want to see is your pet ending up in shelters while you're sick and potentially being exposed to other things. The best thing to do is to stay in place with your pet, quarantine your pet in place, and make sure that you're just not exposing your animal more than absolutely necessary, which would be feeding, watering, letting them outside to go to the bathroom, those kind of activities. The next question we have, what about asymptomatic carriers? Can we pose a threat for our pets even if we don't have symptoms? So normally, you're more likely to be contagious if you're exhibiting signs. So if you're coughing, sneezing, you're more likely to spread the disease. However, with the tiger information that has come out, it's suspected that it was an asymptomatic zookeeper who may have been a carrier who transmitted the disease. So that possibility is there, although we still don't have a whole lot of evidence as to what that really means and how much we should be concerned. Again, tigers and lions are not genetically the same as our small cats, so I think we need further information on the biology of how it is acting in each of these individual species before we can definitively say, oh, all of our kitties are at risk, because up to this point, we've had no confirmed illness in dogs and cats who have been infected with the COVID-19. The next question, should we be bathing our dogs more? I don't think that's necessary based on the literature that's out at this point. Fur contamination of the virus is not of major concern. The virus lives longer on harder surfaces like desks and doors and stuff like that, while porous surfaces tend to keep the virus in place and not be as high a risk of fomite spread. So again, there's very, very little concern at this point that animals may be shedding the disease for human, for spread to humans. Bathing your animal probably isn't going to make too much of a significant difference. If you've directly sneezed on your dog or cat, especially cat, then you might want to rinse them down so they don't lick themselves. But again, we don't have much information about how that transmission may be occurring. The next question is, how can we minimize risk and prepare? So again, just to review, if you're showing any clinical signs at all, coughing, sneezing, fever, anything like that, please make sure that you're washing your hands before touching your pet and after touching your pet. Make sure that you're wearing a mask appropriately to prevent exposure to your pets as well as other people in the community and your family. And as far as being prepared, again, just have a plan in place. You need to have someone that you can communicate with who is ready to care for your animals should you become sick, and let them care for the animal, as we aren't seeing that animals are contagions between individual people at this point. We were recently on a conversation with a shelter in New York who was, they're getting very, very hard by the COVID virus. They're seeing more and more that animals are coming into the shelter due to people who have succumbed to COVID-19 or at least hospitalized. We don't want to see those animals in shelters. We won't have the capacity to care for them. Please have a plan in place with your family, just like you would with any other disaster. If something were to happen to you, what's going to happen to your furry family members, furry, feathered, scaled? We want to make sure that there's something in place for these animals and that they're going to be cared for in the home if at all possible. Another question is, how can we help? I think just being supportive of your animal community, making sure that you're kind of reading all this media with a bit of a skeptical eye until further information is put out there, or you have communicated with your veterinarian or other health professional. There still are a lot of unknowns. The tests are still early in development phase. So we're going to be getting information daily that will change how we're approaching the disease and management. So just don't, try to remain calm and just let us know how we can help you if you have any concerns. If you have any concerns about working out a plan for your animal or an animal in the community, please just communicate with us. It is also important, as I say, have this plan in place to make sure that you're communicating with other caregivers and have multiple plans in place in case those caregivers are unable to or unwilling to care for your pet in a time of crisis. So there's some statement in the chat here. Please reiterate, was the zookeeper symptomatic or asymptomatic? As far as the information I got, the zookeeper was asymptomatic. They are looking into that further because of staffing and HR and privacy policies. There isn't a whole lot of information as of yet as to whether maybe the zookeeper was mildly asymptomatic, but clearly they were well enough to be at work, and they're suspecting that the individual was asymptomatic. Again, tigers and lions are not the same as our domestic cats, so keep that in mind, but it will be interesting to see when they release further information as to the clinical status of the zookeeper. Another statement, we are following a no-touch protocol for animals removed from a potential COVID-19 owner. Cats and dogs are handled with PPE, then put into a cage or kennel with notation of hands off for at least 3 days, treating the animals as fomites. This should be sufficient, correct? Yes. So right now, as far as handling on site, that is the protocol, to wear as much PPE as possible to protect yourself. Again, there's no evidence that animals are acting as fomites, but we don't want to take any risks. And they say the experts say that within 3 days, any fomite transmission on the fur or whatever would be gone. But I think more and more it is that is not as much as a concern, and that was only with abundance of caution that was issued. Animals are to be on a 14-day quarantine if they're exposed to an individual who tests COVID positive. Again, quarantine does not mean in shelter or in boarding. That means they can stay at home, but just not exposing other individuals in the community or potentially other animals. So the 14-day quarantine is in place for animals as well, again, with the sense of abundance of caution as we learn more about this disease.
Dr. M, we have some questions from our HRA foster parents.
Okay.
One is related to the tigers and lions at the Bronx Zoo. And it says, is there any thought as to whether the virus that infected the tiger had mutated to infect the tiger, or is it the same virus infecting humans?
There's no indication right now to believe that it has mutated. It's very unusual for a virus to mutate. Even with the initial possible mutation that started the human COVID infection, there's still some exploration into how that might have occurred. Right now, there isn't really any talk of a mutation, but I can guarantee you that all of those medical facilities are dissecting the sample that they received from the positive tiger and probably redoing the whole RNA sequence just to make sure that there wasn't a mutation. But up to this point, that there's no indication that that is the case.
And then we have a separate question from another foster parent, and she wants to know, are there any extra steps we can or should take to keep animals with a compromised immune system safe and healthy?
Most of you who have animals with immunocompromised systems are taking special steps anyways, just making sure that they're staying healthy on a good diet, making sure they're not becoming stressed out. Again, quarantining at home would be really important in that situation as well. We don't want to cause additional stress to the animal, and just really communicating with your veterinarian. If you see any concerning signs at all, communicate with your veterinarian. Again, we don't have any real reason to believe that it can be transmitted to our domestic cats at this point. We may see that down the road, but right now I would say just continue to handle your immunocompromised animals the way you normally would, and being particularly cautious if you or anyone else that your animal comes into contact with is exhibiting clinical signs of COVID infection.
Dr. M, we had one more question from the chat. Should we not allow anyone to touch our dog while we're out walking our dog?
So that's a great question. Again, we have not seen a transmission of disease from animal to human. There's no indication that it lives in the fur. But my bigger concern with that would be, how are you maintaining that social distance from the individual who may be petting your dog? We want to make sure, above all else, we've been told over and over again, social distancing, and that's really going to be the most effective way to prevent spread of disease. So that would be my bigger concern in that question, not so much is someone going to give your dog COVID, or is your dog going to give it back to you through them? It's more just making sure social distancing is being observed at all times.
And one more question we had from the chat. Would you be able to explain what the term fomite means for folks who might not know what that means and how they can be prepared for it?
So a fomite is anything that can have infectious disease on it. So that would be, the most common examples are doorknobs. If someone is sick, even if they aren't symptomatic and they're spreading the virus, they touch the doorknob, the virus is now on the doorknob, then someone else comes along and touches the doorknob and they could potentially be infected from the doorknob. It seems as though that's less of a concern with COVID infection versus the direct person-to-person contact and spread. But with any disease process, we're very concerned about the potential for inanimate objects, or even people can act as fomites if it's on their clothes or their hair or hands. Fomite transmission is just transmission from inanimate objects or something that isn't actively replicating the virus and spreading it.
We had another question come in through the chat. If we get sick, should we continue to care for the animal, correct? If we can no longer continue to care for the animal, is it safe for a neighbor to say take in the animal to have them in their home?
So ideally they would stay in their home if at all possible. You'd want to eliminate or limit your contact with your animal. Again, if you can stay in a separate room from them and only feed and water them, again, washing your hands before and after doing those things, making sure you're not directly in contact with the animal. But indications suggest that it would be fine for your animal to be housed at a neighbor's house or a family member's house. Again, the main thing would be that your family member or neighbor doesn't come into direct contact with you, then it's likely safe that the animal can go to another household, but with the recommendation again that the animal is on a 14-day quarantine wherever he or she ends up going.
Jenna is now exiting.
The other important part of that too is, again, to make sure that you're communicating with the potential caregivers and making sure they are comfortable with that situation and making sure that there is a plan in place. Again, we want everyone to be safe, but you should have a plan in place. Any other questions? Thank you for joining us today. I think this is all really fascinating information and clearly affects our day-to-day work and our lives with our furry and family members. I also did want to say, as I keep saying furry, I do have feathered and other family members, but it does seem that COVID at this point is only of concern for mammals, and most specifically ferrets and cats. Those are the species that we're really going to be watching and making sure that we don't have anything developing for those individuals. Okay, if we don't have any further questions, thanks again for being here today. Please feel free to send us any additional questions that may come up or anything that you think of later. The recording will be posted at humanerescuealliance.org later today. And please, everyone, stay safe. Watch out for all your family members and make sure that there's a plan in place in case something were to happen. Take care, everyone.